If you keep shaving down that callus or using those over-the-counter corn pads, you might be doing more harm than good, especially if you're diabetic. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. After treating thousands of patients with painful corns and calluses, I've discovered that most people are making one critical mistake. They're treating the symptom, not the cause. What most people don't realize is that corns and calluses aren't just cosmetic issues, they're warning signs of deeper foot problems. In today's video, I'm going to show you what's really causing your corns and calluses, why they keep coming back, and most importantly, what actually works for permanent removal. Most people think that corns and calluses are just excess skin that needs to be cut away. But here's what your drugstore foot care products won't tell you. These aren't standalone conditions. They're symptoms of underlying problems. Understanding this difference is crucial if you want to stop the endless cycle of temporary relief followed by frustrating reoccurrence. First, let's clarify what we're dealing with. A callus is a thickened area of skin caused by pressure or friction. It's your body's way of protecting itself like a natural shield. A corn, on the other hand, is more focused and often more painful. It has a hard center that can press on the nerves and cause significant discomfort, especially when you're walking or wearing shoes. If you're finding this information helpful so far, please take a moment to hit the like button. This helps others with foot pain find this crucial information. The reason most treatments fail is simple. They only address the surface problems. Shaving or cutting away a callus might give temporary relief, but if the pressure that caused it remains, that callus will return, often thicker and more painful than before. It's like trimming weeds without pulling out the roots. For diabetic patients, this cycle isn't just frustrating, it can be dangerous. Due to reduced sensation in your feet, you may not feel when you cut too deep or when an infection is developing. What starts as a simple attempt to remove a callus can quickly become a serious wound that's slow to heal. The over-the-counter products you see at the pharmacy often contain salicylic acid. While this can help break down the thickened skin, it doesn't discriminate between the calloused and the healthy tissue. For diabetics or those with circulation problems, these products can actually create wounds that become entry points for infections. Personally, I don't recommend that anyone use them. So what's really causing your corns or calluses? There are several common culprits. Bone deformities like bunions or hammer toes create pressure points where corns and calluses develop. Flat feet or high arches change how the weight is distributed across your foot, creating areas of excessive pressure. Even your gait, the way you walk, can create recurring pressure points that lead to stubborn calluses. If you know someone who's constantly battling with corns or calluses, please share this video with them. This information can save them from years of unnecessary pain and ineffective treatments. Now for the truth about permanent removal. Here's the reality. You can't permanently remove a corn or callus unless you address the underlying cause. No matter how many times you cut it away, no matter what acid you apply, if the pressure remains, the corn or callus will return. That's why professional treatment focuses on two aspects: removing the current corn or callus safely, and then addressing why it formed in the first place. In my office, I use specialized instruments to carefully debride the thickened skin without damaging the healthy tissue. And this provides immediate relief, but it's only the first step. The key to preventing recurrence lies in redistributing pressure across your foot. Custom orthotics are often the most effective solution. Unlike over-the-counter insoles, custom orthotics are precisely designed for your unique foot structure and gait pattern. They work by redistributing pressure away from the problem areas, effectively removing the cause of your corns and calluses. For corns between the toes, often called soft corns, silicone toe separators can be remarkably effective. These work by preventing the bones in adjacent toes from pressing against each other, eliminating the friction that causes these painful corns. If you're finding this information valuable, please hit the subscribe button and notification bell. I post new videos every week with crucial information about foot health, treating common foot problems. For calluses on the ball of your foot, look for shoes with adequate cushioning in this area. Metatarsal pads can often help by lifting and separating the metatarsal bones, reducing pressure on the ball of the foot. These small additions to your shoes can make a tremendous difference in preventing callus formation. When corns are caused by the bone deformities like hammer toes, Addressing the deformity itself might be necessary for permanent relief. This might involve specialized padding, footwear modifications, or in some cases, surgical correction. The approach depends on the severity of the deformity and how it's affecting your daily life. For diabetic patients, regular professional care is essential. What might be a minor inconvenience for someone else can be a serious health risk for a diabetic. Professional debridement in a medical setting ensures that calluses are reduced safely, without creating wounds or entry points for infection. Here's a simple test to determine if your corns or calluses are caused by pressure or friction. Notice when they hurt most. If the pain is worst when you're standing or walking, pressure is likely the main culprit. If they hurt more when you're wearing certain shoes, friction is probably the primary cause. This distinction helps determine the most effective treatment approach. Moisture plays a surprising role in callus formation. Excessively dry skin is less flexible and prone to thickening in response to pressure. Using a good moisturizer daily can help to keep the skin supple and less likely to form calluses. However, avoid applying moisturizer between the toes, as excess moisture in these areas can lead to maceration and fungal infections. Your footwear choices have a tremendous impact on corn and callus formation. Shoes that are too tight create friction, while shoes with inadequate support allow excessive movement and pressure. The ideal shoe should have a wide toe box, good arch support, and cushioning in high pressure areas. For those who must wear dress shoes or heels for work, consider using protective padding during these times and switching to more supportive shoes whenever possible. Even a few hours of relief each day can make a significant difference in preventing painful buildup. Regular self-examination is crucial, especially for diabetics. Check your feet daily for any signs of redness, irritation, or skin thickening. Catching these issues early can make them much easier to address before they become problems. If you do notice a corn or callus forming, don't wait until it becomes painful to address it. Early intervention with appropriate padding and footwear adjustments can often prevent it from developing into a significant problem. For those who enjoy DIY approaches, here's what actually is safe to do at home. Gentle use of a pumice stone after bathing, when the skin is soft, can help manage minor calluses. Always rub in one direction rather than back and forth, and never attempt to remove the entire callus at once. The goal is gradual reduction, not complete removal. What about those foot peels that have become popular on social media? While these might remove dead skin temporarily, they don't address the underlying causes and can be particularly dangerous for diabetics or anyone with compromised circulation. The dramatic peeling of these products can create open areas in the skin and become vulnerable to infection. Remember, corns and calluses are your body's response to a problem. They're actually trying to protect you by creating a thicker layer of skin in the areas experiencing excessive pressure or friction. The key is not to fight against the natural response, but to address why your body feels the need for this protection in the first place. If you're dealing with painful corns or calluses that keep coming back, despite your best efforts, it's time for a professional evaluation. In my office, I can identify exactly what's causing your specific problem and create a comprehensive plan to address it. Please take a moment to like this video and share it on social media. Your simple share could help someone find relief from chronic foot pain. Also, leave a comment below if you have any questions about corns, calluses, or other foot problems. I do my best to respond. If you're ready to stop the cycle of temporary relief and frustrating recurrence, schedule an appointment for a comprehensive foot evaluation. The link to do so is in the description below. With the right approach, you can find lasting relief from painful corns and calluses. Thanks so much for watching, and have a great day.